Greetings and welcome. I am Dr. Nick Colatrella, and I am here today to talk to you a little bit about Valeda Photobiomodulation for dry macular degeneration. We put together this virtual seminar to talk about the new treatment that's available. We're going to go over who Pinecone Vision Center is, what is dry macular degeneration, how has Valeda Photobiomodulation changed our thought process, how did we get here with the light sight trials, and who might be a candidate for the treatment. So, without further ado, yeah, Pinecone Vision Center, we've been in operation for over 20 years. We saw our first patient back on June 8th, 2004, when I had a lot more hair there with our first patient. Today, we have 45 plus employees, two locations in Sartell and St. Cloud. 8 doctors, have 25,000 patient encounters a year, and we have student interns and externs from all over the countries, from the various schools and colleges of optometry. I have been blessed to work with an amazing team of doctors. Dr. Hinkemeyer and Faso make out our rest of our partners. And we have Dr. Simmons, Dr. Altman, Dr. Ronning, Dr. Richard, and Dr. Thronson. Amazing group of doctors. You can't go wrong by seeing any one of them. Our mission statement: we have always been committed to exceeding and anticipating the needs and expectations of our patients and the community. We are devoted to comprehensive eye care, outstanding customer service, and really what comes into play here, state of the art technology, especially new and expanding technologies, along with the advancement of the profession through continuing education of our staff and doctors. We have been awarded several accolades, and we've been honored to receive them over the years with our small clinic. The first was we were the first Sartell Chamber of Commerce Business of the Year in 2009, and Central Minnesota's Best Series. We've been the best in eye care for every year they've had it available: 2015, 16, 17, 18, 22, 23, 24, and 25. The Minnesota Optometric Association has awarded our clinic with a Para Optometric of the Year, two Young Optometrists of the Year, one Optometrist of the Year, and a Distinguished Optometrist of the Year as well. Minnesota Monthly Magazine named Dr. Hinkemeyer one of the top doctors in 2025, and we were the PDIG Site of the Year also in 2025. So, no surprise that we were the first clinic in Minnesota to offer Valeda photobiomodulation. And the real reason we've kind of picked it up is there's been a paradigm shift in how we treat patients with macular degeneration. And I've been doing this long enough. I've seen very similar shifts in how we treat and manage our patients with glaucoma and dry eye. In glaucoma, we used to wait for patients to go blind or start to lose vision, rather, with changes to the visual field. And now we're treating it so much further upstream with new technologies and treatment to prevent them from ever losing vision at all. Similar, we're doing the same things for dry eye now with patients. We're monitoring their glands. We're treating them with OptiLift and OptiLight and going in much sooner before it becomes a real problem. Now we're trying to interject when degeneration is still dry, to prevent the further loss of vision and hopefully delay the progression over into wet macular degeneration. And as a leader in eye care in Minnesota, we wanted to jump in, and we did with both feet, to offer our patients that treatment now for something that I know will become the standard of care in the next 5 years. And according to Lumathera's website, we are still the only clinic in Minnesota. You can see these are all the sites in the country that have the Valeda photobiomodulation. And if you zoom in on Minnesota there, you can see we are the only ones in Minnesota that has it. And why? Because macular degeneration is a retinal disease that results in irreversible and severe vision loss. If the progression inevitably leads to significant visual dysfunction and serious compromises in quality of life scores. There are two distinct forms. We have the dry and the wet. The dry, or the non-exudative form, accounts for 85 to 90% of patients and shows disruption in the RPE and the outer retinal layers. The exudative wet form accounts for 10 to 15% of patients and shows bleeding and swelling with disruption to the central vision. And up to this point, there really have been no approved treatments for the dry or non-exudative form of macular degeneration, except guidelines on vitamin supplementation and UV protection, So it represents a very high impact patient population with a significant unmet medical need. Now, patients who unfortunately progress to the wet form of macular degeneration are treated with injections to specifically target VEGF or vascular endothelial growth factors. And those treatments have been amazing and have helped patients that previously would have gone blind and have kept them sighted. So it's amazing that we have those treatments available. Now we have something for our dry macular degeneration. So looking at the three pictures in the middle here, here is the optic nerve, retinal blood vessels, and in the circle here is the center part of the eye of a normal macula. On the left, we have a patient with dry macular degeneration, and these little yellow areas here are drusen or deposits, and that leads to central thinning and progressive atrophy in the center area. And then if you go all the way over onto the right side, that's where the patient has wet macular degeneration with bleeding and swelling of the central retina. Now, we know macular degeneration impairs central vision, affecting the patient's ability to perform daily tasks and seeing details clearly. The dry form causes a gradual vision loss, resulting in blurry or distorted vision in the center field of vision, whereas the wet macular degeneration progresses rather quickly, leading to severe vision loss due to abnormal blood vessel growth beneath the retina. Early detection is key to any disease processes, and it is here as well. Early detection and treatment are essential for preserving vision and slowing the progression of macular degeneration down. And we know in the early stages of macular degeneration, sometimes they're symptomless, but as the condition worsens, there are clear signs to look out for. Patients can have wavy or distorted areas in their vision. They can have loss of central vision with dark or blurry spots appearing, color perception changes, the need for brighter lights to see everything that they're looking at, and ultimately leads to difficulty recognizing faces and loved ones. So Valeda photobiomodulation uses three wavelengths of light to improve mitochondrial function on the retina, increasing cellular energy, reducing stress and inflammation, and helps protect the retina in patients that have dry AMD. And here's a video that we have showing how it works.
Valeda Light Delivery System is the first and only FDA-authorized treatment for dry age-related macular degeneration to improve vision. Valeda Photobiomodulation Mechanisms of Action. Photobiomodulation, PBM, harnesses the power of light to target disease at the cellular level. PBM treatment delivers select wavelengths which act on cellular mechanisms important to age-related macular degeneration, AMD. PBM activates photoacceptors in the mitochondrial respiratory chain. The specific wavelengths in PBM treatment increase enzymatic activity at two separate sites on cytochrome C oxidase, CCO. Increased CCO activity helps drive the generation of the proton gradient required by ATP synthase to produce energy. Restoring the production of energy, ATP, and signaling molecules triggers secondary effects that sustain improved cell function. PBM treatment has been shown to improve visual acuity. Photobiomodulation treatment with Valeda harnesses the power of light to offer a brighter horizon for patients with dry AMD.
Yeah, it's so simple, it's genius, and it's really been quite beneficial for our patients with dry AMD. So we know it works. So how do we do it? And we really give it in series. We do 9 treatments equals 1 series, and we typically do several series throughout the year. And that's how they did it in the FDA studies. So 1 series, 9 treatments is generally given over a 3 to 5 week period. We typically do them Monday, Wednesday, and Friday over a 3-week period. And we leave those remaining 2 weeks if there's any disruption in the schedule due to weather or other travel or something like that. So we can still get those patients in. Then we look and reevaluate in about 4 months to see if we need need to repeat the series and then move on from there to kind of take a look at everything. So, how do we know all of this works and why are we so excited about it? And really, it was all the studies. The light sight studies were the studies that they used for the FDA authorization. And they had the 1, the 2, the 3, and now the 3B. The Light Sight 1 was an early proof of concept study that was published in 2020. This was given in a single center, 2 treatments over a 1 year period. The best responses here were seen in patients that have earlier disease, but what we found out here that it did fade over time. So 6 months was a little bit too long. So moving on now to the Light Sight 2 study. This one was published in 2022, but the majority of the work here was done in 2020. So unfortunately, a lot of this study was disrupted by COVID-19. But it showed significant improvements here as well. And it even showed disease modifying effects where geographic atrophy, where you have significant central atrophy, was numerically lower in the photobiomodulation group compared to the sham and the control groups. And then the Light Sight 3 study, this was published in 2024. And this is really the pivotal study that allowed it to achieve the FDA authorization. These patients were tested over a 2 year period. And this first part was a 13-month of those 2 years that they had where it met its primary endpoints. Again, showing new onset GA occur less often in the photobiomodulation group compared to the safety group. The one we're most excited about was the one that was just recently published in March of 2026. This is the Light Sight 3B. This looked at the entire 2 years of those patients of the study, and what they found at month 21, 61.5% of the patients in the photobiomodulation group gained at least 5 letters of vision, 23% gained 10 letters, and 4.4 gained at least 15 letters. We're talking gains here rather than loss, so significant improvements from where we were before. And it really showed disease modifying signals that geographic atrophy at month 24 was 24% increase in the sham treated eyes versus 6.8% in the photobiomodulation group, which is significantly lower from where they had started. And the 24-month study really suggests that Valeda may both help vision and lower the chance of developing more advanced atrophy in those selected dry AMD patients. Pretty astonishing stuff. So, all sounds great. Well, who's a candidate? Well, obviously, you should have dry macular degeneration. The earlier, the better. Earlier in those intermediate patients really did quite favorably well. In patients with useful central vision still present, did quite well also. You do not want to have any active or prior neovascularization, so no wet macular degeneration for these patients to be treated. And you want the presence of at least 3 medium drusen or 1 large drusen, and your doctors can help you determine if you have that or not. And acuity, best corrected visual acuity in the range of 2032 to 2070. And of course, need to have the ability to complete the recommended treatment series and ongoing follow-up. As we said, it's quite intensive. There's 9 to kind of start, and it may continue on as we go through that. Of course, this is still part of a bigger plan. We have ongoing retinal examinations, OCTs, review of symptoms, and discussion of treatments. All that's kind of in there. And it does not replace your regular follow-ups, your home monitoring systems, lifestyle counseling, and of course, always keeping a watch on conversion into wet macular degeneration. So there's a lot of patients out there that are potentially candidates, and there's a lot of questions that kind of pop up as well. So a couple of them that are here. Is it a cure? Man, I wish. No, it is not. It is a treatment option that may help preserve or improve function in selected patients. Does it hurt? Really, it does. It's pretty non-invasive. The studies were great. There's no needles, there's no injections, there's no dilation. It's pretty non-invasive and was generally well tolerated in the studies. Will it restore you back to normal vision? Unfortunately, not. It will not. The goal is meaningful, functional vision. If we can get any improvements, we'll take it. We're not looking for perfection. We are just trying to keep things stable and stop them from progressing. Do I still need regular eye care? Of course, yeah. The Valeda is only one part of a broader AMD treatment care plan. We want to continue the care that you receive from your primary eye care doctor. If you're seeing a retinal specialist, you want to continue the care there as well, in addition to having the PBM treatments. Is it covered by my insurance? A definite maybe. At the end of 2024, when it was approved in 2025, Medicare put out a temporary code. So we can check for your insurance to see in the office is it is covered. Hopefully, in the future, we'll have more information on that. How many visits are needed? Quite a bit. The clinical trials use a series of treatments over several weeks. Like we said, we do Monday, Wednesday, and Friday for 3 weeks for a total of 9. And then we repeat them at every 4 month intervals for 1 year, which is 27 sessions. And then in the FDA study, they even did it for a second year, which is 54. That's quite a few sessions that you have to go through. How long has Valeda been available for macular degeneration? Well, even though it just received FDA approval and rolled out at the end of 2025 in the US, it has been available and it obtained the CE mark for device treatment, which is Europe's FDA approval process at the end of 2018. It has been in Europe since 2019 being treated. So it's been around for quite some time with some favorable results. And then, am I a candidate? That really depends on your stage of macular degeneration, your retinal imaging findings, and all those things that we can help you determine at your Valeda pre-planning visit. So, in conclusion, dry macular degeneration has long had limited active treatment options, and Valeda is a promising non-invasive office-based therapy, which was studied in the Light Sight trials that showed promising benefits. The evidence suggests it may help selected patients with early or intermediate or dry AMD and help preserve or improve visual function, but it is not a cure and works best when paired with realistic expectations and ongoing retinal care. So, if you want to know if you or a loved one is a candidate, we recommend setting up a Valeda pre-planning visit at our Sartell office. You can do it online. You can call the office, and we're happy to take a look at you and get you more information and answer more questions. But I thank you for your time. And if anything else pops up, please don't hesitate to let us know. Thank you so much.